Welcome to Epg Pathshala. My name is Purendra Prasad. I teach in the Department of Sociology, University of Hyderabad. Today I will be talking about irrational use of drugs and unethical practices in India. This is module number 18 in Sociology of Health course. Now, appropriate use and economically putting the drugs to proper kind of a use is very important to achieve quality health care in any society. But across the globe, it is evident that not so useful way of applying the drugs to human bodies actually has become a major kind of a problem. What do we mean by inappropriate use of drugs? It could be in terms of over usage of medicine. It could be in terms of using the medicine not based on any prescription, but based on some knowledge shared by some peer groups. And this could be in terms of the way antibiotics actually are used without actually knowing how much dosage to be used and for how much time it should be actually administered. So these are all different forms, and therefore these are all actually called in terms of irrational use of drugs, and this irrational use actually has been causing one of the major health problems. In fact, Ivan Illich in his book Medical Nemesis, Limits to Medicine, he clearly says that iatrogenesis, wasteful use of medical resources, is one of the serious problems that modern societies actually are facing. So it is not simply a problem of developing countries, it is not a problem of illiterate people, but this problem is there across the world. However, there is much stringent kind of control mechanism in the advanced countries. There is higher educational status, the resource position and the qualified doctors who are available and accessible to the communities is much better. And therefore, this irrational use of drugs actually becomes a serious kind of a thing in the third world countries and in particular Indian context. So if you look at the Indian context where anyone can walk across the road to a medical store, buy any medicine without any prescription. So it is not only in terms of registered and licensed kind of a medical stores, but in small villages also you have, in the provision stores and kirana stores, you have some drugs which are available. Neither the seller nor the buyer actually know in terms of its efficacy, the duration, and whether they are actually out of date, etc. So this actually has been a major problem which is pointed out by several kind of research studies. There are different forms of irrational drugs. One is actually polypharmacy, meaning that if one actually takes multiple pills, of course prescribed by the doctor, but it does have actually a side effect. What is the extent of side effect if one uses multiple kind of drugs for different ailments is something that even medical research actually has been only successful to a limited extent. So that's one of the major form of causing danger or risks to individual bodies. Similarly, use of antibiotics, overdosage, or in terms of underdosage, the way these actually pills are actually bought over the counter, all these lead to the different forms of irrational drugs that are available in the country. Why are we talking about this as a sociological kind of a concern? Because given the healthcare structure in India, where a large majority of the doctors themselves are not actually qualified, they do not actually have any orientation with the Indian Medical Association or with any of the professional bodies. They are actually driven by the market. It is only through the medical sales representatives and the pharma companies, aggressive kind of marketing strategies, that doctors actually become prey to. And therefore, it is not simply about scientific application of the medicine to human bodies where there is a problem. It is actually in terms of the mediating factors, where neither the kind of doctors who prescribe them nor the consumers who are actually taking them have any clue about the efficacy and safety of the drugs, which is one of the important problems. In fact, World Bank in the recent 2004 report also says that the irrational use of drugs actually in India is one of the major kind of issue for rising diseases and disease burden and health risks. So when you look at the kind of concerns that we have, one is in terms of problem of doctors. If you look at the doctors, not only in rural India, who are not qualified, who actually dispense medicines at a very low cost, in order to maintain the patient pool, there is a tremendous pressure on them not to enhance the fee. As a result, a lot of substandard and spurious drugs at a low cost actually are supplied, which are actually given to the patients. So one is the supply of drugs at that level. Second, even these hospitals and the corporate kind of health establishments in urban India also resort to a lot of practices which are unethical, which are not actually prescribed according to Medical Council of India guidelines or regulations, but these are all dispensed. There is no accountability of these private hospitals to any agency. This also actually forces them to actually give medicines which are not required, and in order to sell, I think these practices are rampant in India. And more importantly, the linkage between the pharma companies and the doctors. A lot of these pharma companies actually give incentives, gifts, send them on tours. All these things actually induce them to actually prescribe medicines which are unwanted and irrational. In fact, WHO's list of essential medicines has only to the extent of 12 to 15 antibiotics as part of the essential medicines. But in India, we have 10,000 formulations which is available in the market, and they are aggressively pushed into the small clinics and hospitals and so on and so forth, which actually means that they are all being pushed into the human bodies, causing a serious kind of a health hazards. In fact, one of the scholar by name Bergs in 2014 says that when he interviewed a pharmaceutical sales representative who resigned from the job, his explanation was that he was not able to comply with the unethical practices that is being forced upon him by the pharma company. They are supposed to give the incentives, and there is certain prescribed kind of reward or incentive structure that pharma companies actually ask the representatives to give it to the doctors. But some of the doctors actually demand more. Then it is the representatives who have to negotiate and mediate with the pharma companies. And quite a few doctors have been demanding actually foreign tours, have also been asking them to indulge in actually supplying women and other things. So this sales representative says that I am not a pimp to do all these kind of mediocre jobs, and therefore I cannot actually work any longer. Now, these are instances to say that how corrupt practices, malpractices, unethical kind of practices are all rampant in the medical kind of a industry. Similarly, when you look at the range of unethical practices, if a particular kind of a insurance, medical insurance actually is available, is being actually implemented in Andhra Pradesh, in Maharashtra and in some other states, there are certain procedures, only those procedures actually are eligible for medical insurance. However, to actually make it work where it is not necessary for the patient, doctors and hospitals actually prescribe them that they need to undergo a particular procedure which is actually quote unquote part of this medical insurance scheme, and so that the companies get reimbursement from the state government or from the central government. So the unethical practices which are actually interlinked through the insurance companies as well. So you have for instance, I think between the first opinion and second opinion, a research study indicates that there is a huge kind of gap where unwanted kind of procedures and unwanted surgeries actually are being prescribed. One of the study actually indicates that for cardiac there is about 58% gap between first consultation, first opinion and second opinion. So where it is not required, actually the doctors and hospitals actually have been administering those surgeries, and where there is no block which requires any stent, today actually most of the doctors prescribe stents for the cardiac problem. Okay. Angioplasty and angiogram has become a very, very common phenomena because there is medical insurance scheme, there is something that people actually would go sell their assets and pay if you say that there is a serious health crisis. So in that sense, a major kind of unethical practices are going on in terms of the cardiac surgeries in the country, the stents which are manufactured of a lower kind of a quality and which are being actually inserted into the human bodies, leading to a lot of health risks. Similarly, in terms of hysterectomy operations, knee replacement surgeries, lot of unethical practices which were reported between the first opinion and second opinion. So, irrational use of drugs, pharmaceutical kind of ingredients is something that has become very rampant at different levels. So, we are trying to look at how a market actually influences the decision making processes, how unwanted kind of surgeries and procedures have become a day-to-day phenomena within the health sector. These are some of the concerns that sociologists, health activists and the civil society organizations working on health have been pointing out that there is a serious need for actually bringing a kind of a regulatory system into in its place. Okay. So, the regulatory mechanism which is actually CSDSO, which is supposed to maintain the standards and the regulation of the pharmaceutical industry, is not actually able to do it, and therefore, I think pharma companies are able to reap to the extent of 1000% profit, and this is something it is not 100% profit, it is 1000% profit. One could imagine what is happening with that of the production of the spurious, the substandard and irrational drugs into the market, and given the kind of inequalities in the country. So, one is not saying that there is inherent risk in the drug itself or pharmaceutical ingredient itself. Yes, there are also concerns at that level, but even in those domains where pharmaceutical ingredient or drugs actually are properly, safely actually prepared, and there is a quality drug, but it all depends upon who uses it, how it is being administered, and how actually these the kind of treatment regimen is complied with. So, there are a lot of these issues are not simply about medicine, but it is to do with the medicine which is to be applied or used by the people who are suffering. Okay. So, there is a human dimension, and this is where in terms of usage also makes these drugs actually rational. Okay. Mark Nichter's study in Karnataka actually indicates that even in primary health centers, when these patients from rural areas actually approach for medicines for various ailments, because these government hospitals have a same kind of medicine, meaning that they appear actually similar, they are all in white in color, they all are given from the same set of medicine kind of bottles. So, what actually patients assume is that all these medicines are same, and if they use 3 to 4 tablets at a time, their bodies actually cannot cope up or tolerate, and because they do not have actually strong food, they are not able to take milk, or they are not able to actually eat non-vegetarian food, etc., or some strong food. Therefore, you cannot take all 4 medicines at a time. So, what they do is they throw 2 tablets and take 2 tablets and leave the health center. So, he says that when you go to a kind of primary health center or sub center, you find lot of medicines actually around the building. So, it is also about how medicine is actually used, which means that the patient actually who is receiving it, what is his cultural kind of a belief how he actually perceives this medicine also becomes important. So in that sense, the irrational use of drugs actually is a major kind of a crisis at different levels. And in fact, in the recent parliament, I think 59th Standing Committee on Health actually submitted a report which says that lot of pharma companies actually advertise in the name of certain brands, and these branded drugs actually are advertised directly to the consumers in the newspapers, violating the code and the kind of laws that are actually incorporated within the CDSDO's kind of health regulating authority. So what happens is that a lot of people actually would be moving from generic drug to branded drug, thinking that they are actually using a different set of medicine, while it is not. It is the same combination of medicine which is available at a lower cost as generic medicine is being actually sold at a higher cost, but because it has a different brand name and the doctor actually prescribes it, you use branded drug. So several studies indicated that doctor shopping, meaning that people, when they are not actually getting cured, they move from one doctor to another doctor, where these doctors actually prescribe the same set of medicine but in terms of different brands. So you are moving actually from one branded to another branded, and you are wasting a lot of resources that are available. So these are some of the concerns, okay, that is being actually articulated in the health sector. So how do we address some of these problems in terms of irrational use of drugs? Okay, one, obviously I think the health system itself need to be restructured in such a way that you have actually qualified doctors or qualified paramedical staff or trained community health volunteers who can dispense medicines which are safe, efficient and efficacious. I think that is something that state needs to ensure, that whether it is in public health sector or in private health sector, these drugs will have to be administered according to its dosage, right dosage, right time, right kind of a disease for right person. So if these are not actually followed, the health risks are going to only enhance. Okay, and this is one set of solution. Second one is that instead of actually trying to educate the patient, saying that you do not require, say, injection medicine, you do not require higher dosage of medicine, a lot of practitioners actually give medicines as per the demand of the patients. Okay, so because patients actually say that we need actually higher dosage or we need injection medicine, doctors actually dispense it, thinking that to keep the patients actually happy and ensure that they actually come back again and again. Okay, so there is an alternative way of educating the patients and making them realize what is ethical, what is unethical, what is rational, what is irrational kind of drug use. I think these practices also need to be incorporated. So it's not simply about a professional kind of a job, but I think it needs to go beyond medical profession to reach out to the different classes of people in the societies. The third important kind of a solution would be to actually firmly regulate all the unethical kind of practices of the hospitals, and deal very stringently with the pharma companies who are producing substandard and spurious kind of drugs. Okay. So that's again one of the important kind of mandate that state actually has in protecting the citizens of this country, and therefore I think there is a role of state. So all that we are talking about is, there is actually a role of state in terms of actually restructuring the healthcare system, role of state in regulating the market and pharmaceutical companies, and role of civil society organizations and communities actually in terms of demanding more safe and efficient kind of drugs for their own kind of consumption. Unless these initiatives actually are coming from below, and state actually is forced to actually look at these concerns, improving the health status of this country will be a huge problem. And therefore sociology of health actually talks about how irrational use of drugs actually has become a major kind of a issue, largely in third world context, but it's also there even in the developed world.